You take a huge bite of delicious ice cream. Suddenly, a sharp pain shoots across your forehead. Your brain feels frozen. Before that pain disappears, one of your teeth begins to sting. You quickly drop the spoon and press a hand against your face. How can something so delicious hurt in two different places? Is the cold somehow reaching your brain? And why does it seem to travel inside your teeth? Surprisingly, your brain is not actually freezing. Your teeth are not simply afraid of the cold either. Both sensations begin when a sudden temperature change activates sensitive nerves. But the pain in your forehead and the pain in your teeth follow different paths. One is usually a harmless alarm from the roof of your mouth. The other may reveal that your teeth have lost some of their natural protection. So what exactly happens inside your mouth when that first icy bite arrives? Let us begin with the pain inside your head. Its medical name is a cold stimulus headache. Most people simply call it brain freeze. It can follow ice cream, frozen drinks, or very cold air. The pain often appears across the forehead or behind the eyes. It rises quickly. Then it usually disappears within seconds or minutes. That strange speed offers the first clue. The cold has not traveled through your skull. It has rapidly cooled tissues inside your mouth or throat. Brain freeze is more likely when you eat cold food quickly. A large bite spreads cold across a wider area. Swallowing quickly can also chill the back of your throat. These areas are warm, moist, and rich in sensory nerves. They notice abrupt temperature changes almost immediately. This sensitivity normally protects delicate tissues from extreme temperatures. But ice cream creates an unusually fast temperature drop. Your nervous system treats that change as urgent. The warning begins before your mouth can rewarm itself. Now the signal needs a route to the brain. One important route is the trigeminal nerve. It is one of the major sensory nerves in your head. Its branches collect sensations from your face, mouth, teeth, and nose. Touch, temperature, and pain all travel along this network. Cold shocks the palate, triggering rapid electrical signals. Nearby blood vessels may also react during cooling and rewarming. Researchers still debate how these responses combine to create pain. Yet, the nerve signal clearly begins far from your forehead. So why does your forehead hurt? The answer involves a phenomenon called referred pain. Referred pain occurs when the brain mistakes a signal source. Many sensations from the face and mouth share nerve pathways. Their messages reach overlapping processing regions. Normally, the brain interprets those messages accurately. But an unusual signal can make the source harder to locate. The brain may project pain toward the forehead or temples. The pain feels completely real. Yet the ice cream never touched your forehead. This is the first twist. Brain freeze is not pain from a freezing brain. It is pain referred from cold, sensitive structures in your mouth or throat. As those tissues rewarm, the alarm fades. The signals slow down. The pain disappears almost as dramatically as it arrived. For most people, the event is uncomfortable but harmless. Some people experience it often, while others rarely do. Eating speed, bite size, and nerve sensitivity may all matter. People with migraine also seem more susceptible in some studies. But brain freeze does not mean a migraine is developing. It is classified as its own type of cold stimulus headache. Fortunately, you can often stop it without medicine. First, stop eating the cold food for a moment. Press your tongue firmly against your palate. Your warm tongue helps restore its normal temperature. A sip of room temperature water may help as well. Then breathe slowly and wait for the nerves to settle. Prevention is even simpler. Take smaller bites and let frozen food warm slightly. Avoid pressing a large, cold mouthful against your palate. This limits the sudden temperature change that triggers the alarm. But this only explains the pain in your head. Tooth pain begins in a smaller, more complicated structure. Imagine cutting a tooth in half. The hard white surface is only the outer layer. Beneath it lies a living sensory system. Enamel covers the visible crown. Enamel is the body's hardest material. It protects the tooth from chewing chemicals and temperature. But enamel is not equally thick everywhere. But it can wear down, crack, or decay beneath. Enamel lies a softer layer called dentin. Dentin forms most of the tooth structure. It looks solid, but contains thousands of microscopic channels. These tiny passages are called dentinal tubules. They run inward toward the tooth's central pulp. The pulp contains blood vessels, tissue, and sensitive nerve endings. When dentin is covered, cold barely disturbs this inner system. Enamel protects dentin above the gum line. Gum tissue and a thin cementum layer protect the root. Problems begin when that protective covering thins or disappears. The dentinal tubules then become exposed. Cold food can affect them instantly. But the cold need not touch a nerve directly. This is the second twist. Each open tubule contains fluid. A rapid temperature change makes that fluid move. Cold generally pulls fluid outward through the microscopic channel. That movement stimulates cells and nerve endings near the pulp. The nerve responds with a short, sharp pain. This is known as the hydrodynamic theory. It is the leading explanation for ordinary dentin hypersensitivity. Pain often begins immediately when cold touches the tooth. It usually fades quickly after the cold disappears. That differs from a deep toothache that continues afterward. So how does dentin become exposed? Sometimes the gum recedes from the tooth. This reveals the root where protection is thinner. Aggressive brushing may contribute to wear near the gum line. Gum disease can also cause the gums to pull away. Acidic foods and drinks may erode enamel. Frequent acid exposure softens the surface, making wear easier. Grinding can add cracks and surface wear. Recent whitening may temporarily increase sensitivity as well. However, not every cold-sensitive tooth has exposed dentin. Tooth decay can breach the protective layers. A cracked tooth may react sharply to cold and biting. A damaged filling can expose vulnerable tissue pulp. Inflammation may produce stronger or longer-lasting pain. That is why the pain pattern matters. Brief sensitivity across several teeth may suggest exposed dentin. Pain in one particular tooth deserves closer attention. Pain lingering after the cold disappears is another warning sign. Swelling, fever, a bad taste, or biting pain need professional care. These symptoms may indicate decay, infection, or structural damage. Ice cream did not necessarily cause the problem. It may simply reveal a problem already developing underneath. Brain freeze and tooth sensitivity can happen during the same bite, but they are not one pain traveling from tooth to brain. Brain freeze begins in cold, sensitive tissues of the palate or throat. Tooth sensitivity begins when cold disturbs exposed tooth structures. Both messages can travel through trigeminal nerve branches. Their starting points and meanings differ. One usually warns about sudden temperature change. The other may warn that a dental barrier has weakened. Your response should depend on which pain you feel. For brain freeze, pause and warm your palate. For sensitive teeth, avoid direct contact with extreme cold. A soft bristled toothbrush can reduce wear around the gum line. Brush gently rather than scrubbing harder. Desensitizing toothpaste can gradually reduce nerve responses. Improvement may require repeated use. Fluoride products can help strengthen vulnerable tooth surfaces. A dentist can identify whether recession, erosion, decay, or cracking is responsible.
Let's find out
Treatment
what's causing
targets
this.
the cause, not the cold itself.
Here is the exposed root. This sealant will protect it.
Sometimes gentle brushing and desensitizing toothpaste are enough. Other cases may require professional dental treatment. Do not repeatedly test a painful tooth with ice. Pain is information, not a challenge. Most brief brain freezes need no medical treatment. An unusually severe headache, persistent pain, or neurological symptoms need assessment. Next time ice cream hurts your forehead, remember the real journey. The cold never reached your brain. It triggered an alarm that your nervous system projected elsewhere. If a tooth stings, that cold may reveal a nearby weakness. One icy bite to warning systems, and two different stories beneath the pain.